This episode of Diabetes Connections is brought to you by the world's worst diabetes mom. Real-life stories of parenting a child with type 1 diabetes. Available now as ebook, paperback, and audiobook. Learn more at diabetes-connections.com.
This is Diabetes Connections with Stacey Sims.
Welcome to our last episode of 2019, and it's a big one, all about Control IQ, the new hybrid closed-loop system from Tandem, recently approved by the FDA. I'm talking with Molly McElwee-Malloy from Tandem, and I'm going to try to keep this intro short. I know you all just want the information, but I do have a few housekeeping and other things to get to. You can always skip ahead if you wish. I will not be insulted. First, when things like this happen, when there is big news in the community, we get a lot of new listeners. So I want to go through some basics. First, hi, I'm your host. I'm Stacey Sims. My son was diagnosed 13 years ago, right before he turned 2. He is now a freshman in high school. He is 15. And boy, time has really flown. My husband lives with type 2 diabetes. I don't have diabetes. I have a background in broadcasting, local radio, and television news, and that is how you get the podcast. We are 4.5 years into this podcast. We have more than 260 episodes, so I would encourage you to head on over to diabetes-connections.com. If you're brand new, scroll through. There's a very robust search feature, so if you want to type in Tandem and see what we've done over the years leading up to this release, or any other topic pertinent to diabetes, you can go ahead and do that. It's very easy to search through. And everything you'd want to know about the podcast, including how to subscribe for free on whatever app you want to use, joining the Facebook group, all about me, it's all there on the website. Okay, let's talk about Control IQ. What is it? Control IQ is a hybrid closed-loop system. It is the software within the pump. It uses an algorithm to automatically adjust insulin in response to predicted glucose levels, and we're going to talk about that, to help increase time in range. And the recommended target range is 70 to 180. And yes, for the international listeners, we have quite a few. This is a USA-centric episode. Control IQ is rolling out in the US. We will be staying up to date on when it is available in the rest of the world where Tandem is already in your marketplace. But this is a USA-centric episode, so when you hear us talking about numbers, that's the system that we're using. For Control IQ, you must have the Tandem t:slim X2 insulin pump, and you must have the Dexcom G6 CGM. The Control IQ software is as simple as a download from your computer to the pump. It does not require a purchase of new hardware. No new pump is needed. You do need to have a prescription from your doctor, and you will hear more about that. If you are an in-warranty customer, the Control IQ update will be free. All software updates released through the end of 2020 are free to in-warranty t:slim X2 users. It doesn't matter when you choose to download the update. The no cost is determined by Tandem's release date, not your download date. As we're right at the beginning of 2020, that probably doesn't matter to most of you listening, but I think it's important to point out. Control IQ is FDA approved for those 14 and up. It is not a replacement for diabetes management, and it is not a cure. There is so much information about this online already from Tandem. I will be linking up a lot of stuff on the episode webpage. They have YouTube videos. There's so many features that we don't even get to in this interview. I mean, the tubing fill, you can now set that to vibrate so it doesn't beep when you fill the tubing and change the cartridge, which I know Benny is just so excited about. But in this interview, we really just scratched the surface. So please know I will be doing follow-ups, and there's a lot of supplemental information on the website. Quick note about Molly McElwee-Malloy, who I'm talking to from Tandem. She was diagnosed 22 years ago this week as a young adult. And as you will hear, being in an artificial pancreas trial changed her life. It changed her career path, everything. And she is one of many, many people who has been with this project for a very long time. We do spend the first 4 minutes of this interview on that subject, on who Molly is and getting to this point. And if you're dying to get Control IQ info, again, go ahead, skip ahead. But I think her story is an important part of all of this, and I think it sets up all the information very well. one more thing. There will be a full transcription available for this interview. A lot of you have been asking for that. That's a new feature I'm making available for the podcast in 2020, so stay tuned on that for every episode. But this transcript will be right on that episode webpage. The best way to read it, go to diabetes-connections.com, scroll down, and click on this interview to open it up. All right, here is my interview with Tandem's Molly McElwee-Malloy. Molly, thank you so much for joining me. I can only imagine how busy you are and how full your inbox is.
It's a really exciting time, for sure.
Oh, no doubt. Well, congratulations. We're very excited. I mean, personally and professionally. I can't wait to talk to you about this. So let's just jump right in. I do have to ask you, though, for people who may not be familiar, tell me a little bit about your background, because, boy, you have been with this project really, I want to say almost since day one. Tell me about your involvement with what has led to Control IQ for Tandem.
Yeah, so I'm sort of what you would call like the obsessed fan who went rogue. So I was in an artificial pancreas trial in 2006, and full disclosure will become no surprise to anybody who knows me, but I have a bit of OCD. And for me, that was manifesting as checking my blood sugar 30 times a day.
Oh, wow.
And yeah, it was really out of control. Or as most, endocrinologists would say, I was a perfect patient with zero mental health quality, but of life. Like, it definitely was impacting my quality of life. But I participated in one of these studies, and it was the, 4 IVs and somebody at your bedside for 32 hours and the whole 9 yards. But for me, it was life-changing that for a period of time I could relax for the first time and like just let somebody else take control, and everything was fine. And I sort of just realized that deep breath at that time was exactly what I needed. And I was like, well, I'm going to do whatever it takes to work on this project. So, at the time I was a professional musician, which makes, getting into science that much easier.
What a good, interesting.
Super, super easy transition and logical, obviously. If you've spent your life being a musician, it makes sense to just go into science. So I went back to school for nursing and continued to participate in trials through nursing school. And then when the month I graduated, they hired me on at the Center for Diabetes Technology at the University of Virginia, which is where all of this magic was taking place. And I have not looked back. They hired me in 2010. I've been acquainted with the algorithm since 2006 as a patient. And here we are. It's almost 2020. It's 2019. And it's finally getting to market. So I've done that, and I worked at a startup called Type 0 Technologies, which commercialized the algorithm, licensed it to Tandem Diabetes Care, and then I jumped over to Tandem to pursue commercializing the algorithm. So a little bit of like a dog with a bone. I'm not going to let this go until it's out, but it was sort of my glimpse at sanity. This is what my life could look like with diabetes if something was managing it in the background. I was really only worried about the big thing. And I saw that, and I was like, that is exactly what I will do. That's what I'm going to be doing. I will do this all the time until it gets there. And it's been a very long journey, very rewarding journey, very difficult journey. But to be here today wearing the device is magical.
Okay, I'm going to stop you there. I could talk to you for a long time about the process, but as you listen, I know you want to get to Control IQ, so I will just say I've talked to Molly a couple of times before, and I will link up the other episodes because the background on this, as you mentioned, Type 0, how Tandem came to have that software, the development of all this, it's really important, and it's really interesting to listen to, so I will link those episodes up. But let's talk about Control IQ. So many questions. What are the first steps? What's going on right now?
So because of this all happening right around holidays, what Tandem's doing kind of behind the scenes and, as we speak up through the beginning or first 2 weeks of January is we're educating the whole diabetes educator and endo workforce, getting everybody up to date, getting everybody ready, making sure we're all on the same page so that when you go to your endocrinologist and say, I want this, as a customer, they are well informed of what's going on. So all of that's been going on in the scenes. Like, just early today, I was on the phone with 10 different doctors trying to make sure that we all understood everything. So we're educating as fast and as seriously as we can. We have an excellent online training program. So you as a customer, if you are a current X2 user, Basal IQ or just X2 Tandem user, will get an email in, I believe it's the second week of January, whatever, January 13th that week. You'll get an email saying, hey, go ahead and log in, update your information, make sure everything's correct. We're going to get the prescription. We'll reach out to your doctor and we'll help you. If you're an existing customer, we have that information kind of fully loaded, ready to go. You could also log into the customer portal and go ahead and start that process of, I'm interested, I want this, and talk to your doctor, make sure all that's in place. It's a super easy script with your doctor that gets loaded. It's an automatic process once we have that. If you've already got that, like a blanket prescription from your provider's practice is already going with us, and we're trying to initiate that in the next 2 weeks. If that's already there, we will automatically check in the background, and it will provide us with going ahead and giving you the green light to issue the next email, which will be, your training is ready. And then you will do the online training, and it will give you the ability to learn all about Control IQ. It's very interactive. You can't hit play and walk off. I know people do this on other trainings. Like, I know we have webinars where we push play and we walk off and we do the dishes and we come back, and you cannot do that with this. It actually won't advance to the next part until you've done X, Y, Z that it's asked you to do. And we've designed that for a reason, so that you actually come away with the knowledge you need to operate the algorithm and integrate it into your life. So then you will answer a couple of questions and take a quiz, and you will have had to pay attention to get this information correct. And if you don't, you can go back and relearn until you do answer the questions correctly. Once you do pass the quiz and the module, you will then get the download code, which is specific to your serial number of your pump. So I know there's been some questions online about, like,
can people share
how
it?
about work? Can you share it? The answer is no. You can't share it. It is your learning, and your code is specific to your serial number. So all of that lines up perfectly to allow you to download the software update. And that will be, everything we'll walk you through all the steps. It's pretty obvious, but for those who think that there's some idea that someone will get a code and then we could post it on the internet somewhere and you can share it, like, sorry, Debbie Downer, you're going to have to get this on your own.
You're so funny.
Like, we're smarter than that, and the FDA is smarter than that, and they're not going to allow, like, one code to rule them all. So everybody's going to have to do this upon their own, and because it requires a prescription, you'll have to go through all those steps.
Well, when you mentioned training healthcare providers, and this might be a really dumb question, Molly, so forgive me, but do they go through a more in-depth training? It just seems like a couple of weeks to try to get all of these endocrinologists and CDEs on board is a tall task. Do they all have to be trained before they can write the prescriptions? And then what is their training like?
So they don't have to be trained before they can write the prescriptions. We want them to be trained before, well, obviously we'd like them to have some knowledge before they write the prescription, but they need the training to be able to treat patients, right?
Okay.
And we want them all to be informed before they write the prescription to know if this is a good choice for their patient. But you could always write the prescription and then the person doesn't do the update, right? So there's always a couple ways they could catch it at the end if they don't intend to write the prescription. But writing the prescription with knowledge is always excellent, and we want them to be aware. It's really, an hour and a half, 2 hours of their time. It's not a whole day thing. I know with other systems, there's been some feedback about, like, the length of training being really long, and we took all of that into consideration. We got the beautiful gift of not having to go first on this, right? So we got to see what happened with the market and with feedback before we did it, and we implemented a training. And the good news with Control IQ is it's not difficult. You do have to understand some concepts and some differences, but it's not hard.
I guess my concern was that people would be calling their healthcare providers and saying, are you trained? Are you trained? Did you do this yet? And, because you could see that happening.
Yeah, and the good news is that we're getting them trained as we speak. So And there's an online module they can take to do this. Like, it doesn't have to be me on the phone with somebody training them, although we are doing that for large offices to have that interaction. But there is an online module that they can take to get trained. So we do have a provider website that has been launched. We've been very patient-centric and very patient-forward in our website and our outreach. And we are adding a new dimension to both Tandem and our website on how we are looking at our business. So to be honest, when you do this business, there's at least three customers you're looking at, right? There's the patient, there's the provider, and there's the payer. And all those things need to be addressed. And we've been very patient-centric. And we're continuing that. We're just expanding to be very have people that are actually focused on providers. And so there is a portion of our website now dedicated to healthcare providers and their education and resources specific to them. So that is launched, that is up and running, and it's actually a really elegant website, a host of resources for healthcare providers.
All right, so let's get to the moment at hand. Control IQ, how does it work? Talk to me a little bit about, the pump settings, or what do we have to do? What is the basis of Control IQ?
Yeah, so this is the most beautiful thing. And I love all things that are based in science, reality, and truth, right? Like, and Tandem doesn't like this either, but we don't like tricks. And we don't like you not being able to see what's going on. So the beautiful thing about Control IQ and Basal IQ, about all of Tandem's technology, is that it's based in the science and the foundation that you know and love, which are pump settings that you already understand. So, the traditional rules that healthcare providers have used, and I can provide you a link to an article or two if that's helpful, on, 15 and 1800, rules that they've always used, and insulin duration action that is built on the foundation of many, many, many decades of science. So all of that, I can provide you some links and to educate people about what does that mean. But your traditional insulin to carb ratio, sensitivity factor, and basal rates all still apply. We use that. The Control IQ technology uses your pump foundations and your foundation sort of basal rate, insulin to carb ratio, correction factor to operate from, right? So those are specific to you. They always have been. They always should be. And that is where we start the game with Control IQ technology. So using those settings, Control IQ technology will be making adjustments from your baseline parameters. So your baseline parameters are exceptionally informative of how Control IQ technology will work.
So we've been using a pump, let's say, in our personal case, for 12 and a half years. We're pretty good at the settings. We're going to talk about insulin on board because that's an interesting change. But we have our ratios and our sensitivity factor. People like us, a lot of people who are used to changing things on their own, you're basically saying we're not going to have to relearn to use the pump that we know so well.
Correct. Right. So all the settings that you know and love are great, and you will move forward with those, right?
Okay, great.
People coming from other systems, like maybe a different pump or multiple daily injections, things like that, you're going to want to establish some really good baseline settings and make sure that those are accurate for you, particularly if you're coming from, a competitor's product like that has automated insulin delivery. You want to make sure that those settings are good to go, because the previous other settings that you may have used only altered insulin on board and carb ratio, right? So if you're only pulling two levers, the other things may not be totally set in stone and based in the reality that you need. So moving forward, you will need to make sure that the patient has, your patient, which would be your son or myself, that user has the pump parameters and settings that are based in what you would want to use. So if somebody's moving from a different product, we just want to do a double check, and there's going to be the healthcare professionals will have a little checklist to go through, and we'll ask them, are you coming from a different product? Please relook at the baseline settings and make sure that they are appropriate for this patient.
Got it.
In your situation, you're just going to be moving from, basal IQ to control IQ, and those settings still apply. I will say a note for your super, super savvy listeners who have used basal IQ, and something we've noticed just in real world data as we've looked at basal IQ data, people have upped their basal rates to allow for, like you to got to be like, suspend, resume, and kind of hug that line at 80. A lot of people have done that. And I want to talk to that community real quick and say, look, I know what you did with basal IQ on riding those basal rates high to kind of hug that line at 80. I saw that. We saw that. You did that. We know why you did that. Just look at them one more time before you go back to control IQ, because control IQ is going to be adding, right? It can add insulin. So just before you go on your merry way with control IQ, double check your baseline settings. Are they where you want them to be before you go, right? Knowing that a system can add insulin to it.
Okay. So you mentioned a lot of my listeners like to ride that 80.
A lot of people love that. They want that super, super tight control. And I get it.
All right.
I totally get it. That particular base of listeners needs to be exceptionally open to the idea that we're now going to be adding insulin, right? So if you've kind of made these aggressive pump settings with basal IQ and now you're going to be just on your merry way, we don't want you to experience any hypoglycemia, right? That's, we don't want to put anybody in hypoglycemia land. It's my personal least favorite experience of diabetes. So let's not do that.
Right. But the question then is, what are the targets? I thought Control IQ wasn't really going to let you ride that 80. Can you talk a little bit about, obviously nothing's perfect. Hypoglycemia can happen. Hyperglycemia can happen. But what is it aiming for?
Yes. If your listeners, and I know they'll be able to have access to this, we'll pull up the little chart on that, sort of the patient pamphlets that I gave you. There's one of them that actually has a really good visual on what that looks like. And just so that we can go from soup to nuts, the person who has now downloaded Control IQ technology, all they have to do is turn it on, right? So you get the pump and then you turn it on. Control IQ technology is on or it's off. Just to preface all of this before we get into targets and all of that, there's no kick out with Control IQ technology. Control IQ technology works so long as we have CGM. And I will say that as long as we have a continuous stream of CGM we will continue processing that data. But if there are 20 minutes or more of missing data from that CGM, and those who are very savvy with Dexcom know that you can kind of get intermittent readings occasionally. I'm not talking about intermittent readings. If you've got a loss of CGM signal for more than 20 minutes, we're going to revert back to your pump settings until we can get that information back up and running. But if we miss a value or two and we come back and we've got that information and we're running full steam ahead, we're good to go. Or if we have any data point in that 20 minutes that pops up, you're still in the game. You're still playing. But there's no kickouts, right? So there's nothing you have to do other than wear a sensor to get this technology to work.
So as you mentioned that, just to be clear, and I'll say it because I don't know if you can, but there's no auto mode or manual mode to kick out of. So if you lose the CGM signal for that period of time, as you said, what did you say, 20 minutes?
It has to be greater than 20 minutes, yeah.
Greater than 20 minutes. Okay, so if you lose CGM signal for 20 minutes, it just goes back to regular Tandem pump. All the settings are in it. When the signal comes back, it automatically starts Control IQ. You don't have to do anything else.
Correct.
Okay,
you could sleep through the whole process, right? Like you do you, right? Like if we lose it, we'll get it back as soon as possible. We're going to alert you that no CGM is available, right?
Right.
We're going to alert you that this is happening. But if you're sleeping or you're doing something else and you are not paying attention to it, we're going to go back and do Control IQ and, keep running with the ball in that process without having to all these bells and whistles. And there's no modes, right? Control IQ is on, or you can turn Control IQ off. There's no modes. All
right. So let's talk targets.
Yes. So there are several targets. What we will call euglycemia, or the main target is the number 112.5, which in the pump, it's going to default to 110. Why? Because you don't have 112.5 as an option to put in as a target. But 112.5, for those who are interested, is a weighted average between 80 and 120 with the least amount of hypoglycemic outcomes. So if you are a statistician or mathematician and you love numbers and you ran a bunch of scenarios of hypoglycemia and when it's more likely to happen in all these different situations, which is what did happen to come up with this number, you would come up that 112.5 had the least amount of hypoglycemic outcomes and the greatest amount of time in range and, successful euglycemia. So 112.5 it is, and it's going to show up as 110 in the settings, but 110 will be the target in the settings that you set up for Control IQ, and it is non-negotiable. We have different ranges for things that we're using throughout the way the system progresses, but as far as it looks on the settings on the pump, it's going to show up as 110. When you enter the system, as long as you're in euglycemia land, like as long as you're in range and predicted to stay in range, which we predict as 70 to 180, or we use in 70 180, we'll use your pump settings, right? Your pump settings should be adequate. But the minute you're predicted to be outside of the range, and this is where this graphic is really helpful, if you're predicted to be 70, right, less than 70, we're going to start decreasing basal insulin. If you're predicted when you start going below 112.5, right? And then when you get to 70, we're going to stop basal insulin delivery. And this is during waking time, right? So this is during regular Control IQ use. If you are predicted to be less than 70, you start going down less than 112.5, we're going to decrease basal, and we'll eventually halt basal. Now, if you're above 112.5 and you're heading up, and you're predicted to be above 160, we're going to increase that insulin delivery, and we increase that in the background until you hit a prediction of 180. And that's not you hitting 180. That's the prediction hitting 180. The prediction hits 180, then we can give an automatic correction bolus once an hour during waking time. And I'll go over more about what that means in a minute. But for predictions to be above 180, if there has not been another bolus in the last hour, we can give one at that point to try to keep blood sugar more in range. So the range is 70 to 180. Again, 112.5 is euglycemia. Going below that, we start decreasing. If you're predicted to be lower than 70, we're going to stop basal insulin delivery. If you're predicted to be above 160, we're going to be increasing basal insulin delivery. If you're predicted to be above 180, we are going to deliver an automatic correction bolus once an hour during waking time. And by that, I mean when you're not using exercise or sleep. So there's 3 activities in Control IQ, and they are Control IQ, or what I call wake time. There's sleep, and there's exercise. And those 3 things have 3 different targets, because if you think about it, those 3 activities have very different applications for your blood glucose. So waking time, 70 to 180. That's sort of where we aim for all things during the day to accommodate for blood glucose fluctuations with meals and stress and schedules and everything like that. Sleep is something you program, just like you would program a basal rate. So if your basal rate normally changed from 3 to 4 p.m. every day, blah, 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 the sleep is you can program that, right? So mine is programmed for 10 p.m. to 6 a.m. From 10 p.m. to 6 a.m., I'm sleeping, and it will automatically go into sleep. It will automatically come out of sleep. I don't have to do anything. And during sleep, we're going to target 112.5 to 120, which is a much tighter range, but we're not giving automatic correction boluses during sleep.
Can you tell me a little bit about the thinking there? It seems obvious, but is it just because a person is sleeping and can't adjust the pump? I'm trying to figure out the logic.
The logic of not having the autocorrection?
Yeah.
The logic around the not having the autocorrection overnight is being super conservative with the FDA and their comfort level. But also, the algorithm really drives a really tight range during that time because there's not a lot of interference, right? If you think about sleep, it's like for blood glucose, it's the easiest time to manage diabetes, right? Because nothing's happening, although you are asleep. So technically difficult because the operator is asleep, right? But as far as what's happening with diabetes, sleep should be a pretty steady state. So if we can automate going into and out of and having a really tight range for that period of time, then we can kind of optimize time and range by, 6 hours a day being really tightly controlled, or however long the sleep activity is. And we noticed in the clinical trial, those people who had a sleep schedule, and not everybody did, and you do not have to set one, but those people who had a sleep schedule had significantly more time and range. Huh. So that's just something to notice. No, you don't have to set one, right? Could you have automatic corrections going all night long and be in wake time? Sure, you could do that. If that's how your diabetes works, great. My diabetes, your diabetes, somebody else's diabetes, they're all going to be different, right? We all have different versions of how we metabolize things and how we sleep and how we process and our sensitivity. And sometimes, the sky is blue and sometimes it's not. And it just depends, that's life with diabetes. And that, some things will work for some people, some things won't. We did in the clinical trial have some people we refer to as sleeping beauties, who who had sleep going 24 hours a day. And that would put you at the, like the 112.5 to 120 all the time. No automatic corrections, but you would get basal increase and basal decrease, try to keep you in that range. And for some people, that's great. That's where you want to live. That's fine. You will not get the automatic correction. You will need to give that correction when you need it. It's not going to be enough to accommodate that. But hey, if you're a sleeping beauty and that works for you, that's fine. Then there is exercise. Exercise is a button you press. You go into options, exercise, start. I'm exercising now, and then I will leave it on while I exercise. And when I stop, I will go in and I will stop exercise. And while I'm exercising, there'll be a little running man on the side of the screen to show me that I am exercising. And that will tighten the range to 140 to 160 to help prevent hypoglycemia. It also engages what we call the brakes, or the prevention of hypoglycemia, by 10x. So if you think of a car going downhill, and if you think of getting your brakes tightened 10x, the minute you start going downhill, you're going to stop, right? It's going to be like, whoop, stop, whoop, stop. It's going to be really, really grippy. And that's the way it works during exercise, because we anticipate hypoglycememia. Now, you can still get an automatic correction bolus, and you can still get an increase in basal during exercise, because there are people who will go high during exercise. With the pediatric sports particularly, you notice a big difference between game day and practice day. Like game day, there's a lot of adrenaline. There's usually a lot higher blood sugars. And in practices, there's lots of low blood sugars. This is why that's still going on in the background. Starting it an hour before, starting at the time of exercise, leaving it on an hour after, all of that's going to vary depending upon the person and the activity. And you're going to have to play with that to see what works for you. Different strokes for different folks. And some people won't need to put on the exercise, right? They'll be fine where they are. It just depends on what you're doing, your body, your diabetes, what's going on, and as to when you start it and when you stop it, or if you use it. Likewise, you could put exercise on 24 hours a day if you wanted to, if you needed to ride a little bit higher, or you, were feeling very cautious about something, and you wanted to be, you're driving all day or something. You're like, I just want to be a little bit higher today.
Your kid's first sleepover.
Your kid's first sleepover, and you want that automatic bolus because they're going to snack. And if you think about it, like if I think about my kids, they are active 24 hours a day. I mean, until they crash, right? So if they're super, super active, and I'm getting frequent lows from that activity, I might put them in exercise all day, right? So depending on what's going on with that patient, that time, and what works for you, there'll be different reasons why different activities are better for some people than other people, and when you want to use them. But they're all available to you to use as you want to, right? Because we all deserve choice, and we all should have control over what happens with our diabetes.
It's really interesting. Okay, I'm trying to get through the list because I have 14 questions for everything you answer, so I know we'll talk again. But I do want to ask you about insulin on board, and I will set this up by saying in the last few months, I've been reading up a lot on this in anticipation of what we're going to talk about here, because Benny's insulin on board, which is, as you listen, you may not realize there's a setting in the pump, all pumps, where you try to figure out how long the insulin that you're giving is lasting. And this is with MDI as well, but the pump does it automatically. But you have to tell it, and then it keeps track. So we have always set Benny's at 3 hours. And then when he hit puberty, we kind of tightened it up. And I've learned that it really didn't matter what we said or what we thought, that everybody's insulin on board, studies show, is about 5 hours. And so that's what's in Control IQ?
Yeah, it's at 5 hours. So if you look at some data, and again, I can provide you with links to some published data on that. The data says it's between 4.5 and 6 hours. So let's split the difference. We'll call it 5 hours. So we're using 5 hours, and there's several reasons for that. One, it's established data we can rely on. You can hang your hat on it. Also, it's a static number, right? So if you are trying to aim for targets with a multitude of patients, and you're trying to automate an algorithm, you cannot then vary IOB, right? Without causing some pretty crazy ripples, right? So it's going to work for some people not. We want something that works for most people, right? Like, I understand that this is Control IQ is going to be an amazing solution for a lot of people. And if some people are going to be like, I'm so much better when I do it myself. Great. Fine. Do it yourself. That's fine, right? Like, that's why we have choice. Right. But in order to design a system for the masses, you're going to have to go with the large majority of scientific evidence, right? Which again shows insulin on board somewhere between 4.5 and 6 hours. So going with 5 hours and keeping that static when you're aiming for different ranges and you're allowing people to do different basal rates and insulin carb ratios and sensitivity factors, like, you have to lock something in. And we've locked IOB in. And that gives you some really good results, obviously. But and for skeptics, I'll say just, try it. Try it and see what you think, because it may not be as different as you think.
Well, I've been shocked to find out that the entire looping community and the do-it-yourself folks, all of those systems are based on 5 hours, pretty much.
Right. And you have to assume you have to make some assumptions, right, when you're writing an algorithm that's going to modulate insulin for the masses. And one of the assumptions is, how long does this thing last? If you change that, all the other math has to change. And that makes it a very unstable algorithm, and a very unstable system, and then not for the masses, right? So that is why it's locked in. And there's a lot of scientific evidence, and the DIY community has embraced this too, at that 5 hour time frame.
In terms of the rollout, Molly, I remember when we got Benny's pump about a year before Basal IQ was available. And as I was looking back, it was a pretty seamless process for us in that I remember it was FDA approved. We got the email. We got the prescription from our doctor. Then Tandem said, here's your code, and we downloaded it. And the whole process took from FDA approval to on Benny's pump, and no special treatment, was 35 days. I'm not going to hold you to that. I'm not asking you to keep to a schedule. But I am going to ask, and I think 35 days was pretty great, is there anything that you all learned from the Basal IQ rollout that people who went through that can expect to experience differently this time around, or did it work pretty smoothly?
Yeah, so, I mean, you always learn, right? You always learn, and we're always learning. And Tandem is excellent at collecting data and then understanding, and learning from it. So one of the things that we did learn there is that we needed a more robust patient portal, and so we've done that. We've built a more robust patient portal, and we've built a lot of automation into the background. So doing things like, if you entered, I'm going to update for this, and your physician had a blanket statement on board, and, we could automatically line those two things up. It doesn't have to be a separate step, but just automatically, yes, okay, you're good. We have this checked and our records checked, and we have this, and this is on file, and we can do all of this. So there wasn't a lot of automation that there is now. And there were maybe a couple extra steps involved in getting people either approved or making sure we had all the documents, and we've streamlined all that. So it should be a very seamless process. The update itself could take 8 minutes, but it shouldn't take much longer. It should be 8 minutes from, whatever you're on now, the Control IQ, and then just reschedule it and doing the online training right before that. That's, a little bit of chunk of time, but I think 35 days is pretty good. So we got approval this past Friday.
We got it the 13th. lucky Friday the 13th.
The 13th, and we plan to roll out those emails to existing customers the week of the 13th. So it might be coming it close, but I think you can probably stick your
Molly,
finger on the 35.
I'll give you some grace for the holidays. I mean, the last approval was August, so we only had to worry about back to school. I'm not too worried about 35 on the dot. I did want to ask you a couple of questions from the Facebook group, the Diabetes Connections Facebook group. You've answered almost all of them. But I had a really good question from Tim, who was asking about in the clinical trial. He said, people were able to familiarize themselves with the pump and the system about 2 to 8 weeks, I guess. So he said, what took place during that period and how much interaction with healthcare professionals was required? So I guess the question really is, how much do I need to interact with my healthcare professional? How much do I need to ramp up and learn before Control IQ will work well for me? We've mentioned, there are variables.
Yeah. And I think looking at that run-in phase, which was what it was called, that 2 to 8 weeks, is that's when you were taking people from multiple daily injections, introducing them to CGM technology, introducing them to pump technology, and getting pump settings straight. So that was the longer run-in period, which were people who were completely naive to both CGM and pump technology. And they could be allowed up to 8 weeks. I don't think most of them completed their run-in phase much faster than that. And most people, the people that already had pump or CGM or some knowledge of one or the other, could go at a much faster speed. So it was just getting them up and running and comfortable with the technology, and the physician or whoever was overseeing at that site felt comfortable. This person is ready to proceed to the next step and go ahead and use an automated system. So that just allowed for all walks of life to come in and to do this trial. And that's really what that was about. As far as how many connections, how many touch points with an HCP, I can't speak specifically to each situation, but typically in a run-in phase, when you're getting people up and running that have never used technology before, you might check in with them every couple of days and then do a download at the end of the week and then see if you need to titrate settings. So, and I would suggest at a later time you having one of the site's principal investigators on to talk about the study. It's fascinating.
That'd be great.
And they could really get into the weeds of these details, because I think Tim had a really good question about that. As far as the average person, though, getting up and rolling, the big thing with Control IQ technology is you have good pump settings, right? So that may be a couple of touch points you maybe have with your HCP if you've never had a pump before, right? Or you're just learning for the first time, or if you've had pretty poor settings and maybe pretty poor control all along, and you've never really sat and been like, I wonder if these are right, or your HCP's never sat down with you and been like, let's take another look at this. That may take you a visit or two, but if your pump settings are pretty good, you should be fine to go. And then you can check in with your doctor at your comfort level, right? Like, there's no recommendation. It's as long as you feel like you're doing well, then great. There is a mobile app that will roll out with this. It's embedded in the technology update for Control IQ that will give people access to this mobile app, which will be available on Android and iOS. But this will allow for automatic uploads to the cloud. So the data will be going seamlessly to the cloud. You could also then see it on your phone. You cannot yet bolus from that phone or dismiss alerts or alarms, but you can see what is happening from that phone. And it's in a ways to send data to the portal so that your data is always updated. And so, your healthcare provider can check in and say, how are you doing? And I see this is happening, or I see that's happening. And you can all be on the same page without actually having to physically go into the office or upload your pump or any of that stuff. Just streamlining that process.
That was going to be my next question. But my understanding is that the phone app is going to be just for healthcare providers as it's rolled out, and then consumers can use it down the road. Is that not correct?
No. So maybe there's just two parts to this. So the app will be on the patient's phone, right? That's how the data gets to the cloud. So the patient's going to have visibility to their data. The data going to the cloud goes to the HCP portal, right? So that's a healthcare professional portal. It's a portal that we offer healthcare professionals so they can manage all their patients in one place. So they log in, they can see data as long as you've hit Wi-Fi. And it's available as Wi-Fi as both publicly and people having it at home, or you can choose to use cellular data. You can send your data to the cloud every 5 minutes.
Right. So I just want to be clear. So when I get my Control IQ, let's say let's say I get Control IQ by the end of January. When I get Control IQ on Benny's pump, he will be able to look at his cell phone, not do anything with it, but he will be able to view his pump data in real time on his cell phone?
Yes.
That is amazing. Okay, so I know that many people who are newer might think, well, that's not so amazing. But I mean, after 13 years, we had these dumb pumps and no CGM, to have Benny be able to look at his phone and say, oh, is my battery charged? Do I need insulin? Even the simplest things. And then the idea is down the line, and maybe you can give us a peek into the future. As you said, you can't bolus from it, but possibly someday? Soon?
Oh, yeah. We are working on integrating the ability to do a mobile bolus, yes.
All right. I'll leave that there for now because I know I'll talk to you for another hour about it. But then my last question on the phone is, what about remote data from the pump? Can a parent, caregiver, friend, spouse, once the Tandem information is on the user's phone, can it be shared?
So we're working on a remote monitoring feature, but at this time it will just be available on the patient's phone, and it will be a way to get the data to the cloud. Now, you could log in to T-Connect and look and see what's going on with Benny at school. If he's got Wi-Fi going. It's not really meant to be a remote monitoring system. It's not approved for that, but,
I'm just thinking about all the parents I know. All I care about is it charged and is there insulin in it? But I know a lot of people really want to see, everything. But that's really interesting.
You could do that, and then some people know how to do the mirroring on their phone to another device. And
right.
There's going to be people who figure that out, and we will eventually have a formal system for that. And again, nothing is intended to be remote monitoring or for share type viewing. It's just supposed to be a secondary viewing device. Of seeing the data, but that data is going somewhere and you can log into that place. So you do with that with whatever you want to, but you'll be able to see that data if he's got Wi-Fi going.
Right. All right. Before I let you go, I have to ask you, we started this whole conversation about you talking about finally relaxing when you used an automated system in 2006. So here we are, 13 years later. I know. And I assume you've been using Control IQ. I shouldn't make that assumption, but have you been using Control IQ?
I do have Control IQ on, yeah.
Okay. And I'm asking you this. I know you may be limited in what you can say, and I understand that. Are you as relaxed and feeling more in control of your diabetes as you had hoped back in 2006?
And it makes me a little choked up. I am in a place I never knew existed, right? This is a place that I dreamed about. I'm not worried about what's happening with my blood sugar. I'm not worried. We had my daughter's 3rd birthday this past weekend, and I didn't worry about did I bolus enough for the cupcake because, it had my back, right? I'm if it's, if it's more than this, whatever, it's got me. If it's less than this, it's got me. I didn't worry the whole day, and I stayed in range the whole day, and I got to enjoy my daughter's birthday without worrying about my diabetes. That was pretty awesome, and that's where I want to live, right? I have other things to do. Everybody has other things to do than to try to be their own pancreas and their own organ. So let's relieve that burden, and then you just interact with it with meals, with exercise when you need to. It's much more of a relief than I imagined because in 2006, I was hooked to laptops.
Oh, my gosh, that's right.
Yeah, I was hooked to laptops with 4 IVs in my arms, and I was willing to do that. And I would have walked around like that. So this is some space age invention that never entered my mind that this could have happened. But it is beautiful. It's very eloquently done. I have to hat tip to the engineers at Tandem who took, years and years and years and years of research that weren't done in neat, tidy ways, right? Mm-hmm. And then put it into a system and made it this eloquent and this beautiful, where I don't have to think about the 50 things I would have thought about before. Is my laptop plugged in? Am I plugged into the right USB port? Am I, the things you would have to think about if you were plugged into bigger machines.
Wow, sure.
I don't have to think about any of that. And during research, seeing it in all the different iterations, we still had, even when we had a cell phone, we still had the fanny pack, right? Because you had to keep the receiver and the phone near each other and all this other stuff going on and the pump. And now I'm just walking around with a CGM and a pump on, and it's doing it. And I don't have to worry about any additional things to keep up with. And it's pretty freeing. It's pretty awesome. This is a place that I never even dreamed of, and I'm just so happy to be here.
Molly, thank you so much for joining me, for spending so much time talking about this. It's been remarkable to just for the few years that I've followed along in your journey. It's been wonderful to watch. So thank you so much. And I cannot wait to get this for my son, if I'm being honest.
I can't wait to hear your feedback. I can't wait to see what you think. Because, we'll make 2.0. We'll make 3.0. We'll see what's going on. So your feedback, everybody's feedback is so valuable. So you know what? We should jump in and say, I would have liked to have ended on that emotional note that you had there, but we do have to say, for many people who have been in this community for a long time, who are emailing you and me saying, why can't I get the target under 100? Why can't I do this? I want this feature. I want that feature. And it's not that people are greedy. It's just that, we all want this so badly. It's a great reminder that this is a first step. This is the beginning of the automation. So, I want it all too, but I get it. And I just think it's fantastic. So this is the first one with Tandem. Let's see what happens in the future. So gosh, it's so exciting. It really is. And I could say to people who want to customize everything, want to do everything, look, the future's coming, and it's coming faster than we could have dreamed of. And I realize we waited a long time. Trust me, of all people, I know how long we have waited. But this is a really solid system that we get to build upon. So it's going to be a phenomenal ride. I would invite them to try it, see if you can relax a little, and see if it brings you any kind of peace of mind. And then we'll work on getting the targets exactly where you want them.
You're listening to Diabetes Connections with Stacey Sims.
So much more information on the website. Please check it out. And I know many of you have unanswered questions. You really want to do a super deep dive. You want more. We will dig into the research, as Molly mentioned. I promise we will be doing follow-ups on this. As a Tandem family, we'll have Benny fool around with it and let you know what he thinks. I'm hoping to get him to do a review as soon as we get Control-IQ, which, we're not jumping the line. We're there with all of you. So hopefully by the end of the month, beginning of February, I'm really hoping that we'll have Control-IQ on his pump. And, that brings me to just a quick personal note. Benny was diagnosed 13 years ago in December. So December of 2006 is when we heard those words, your child has type 1 diabetes. And I remember a few bits of information from that day. We were not told, thankfully. We were never told, the cure is 5 years away. We were never told that. And I had been a medical reporter for many years, and I'd covered type 1 diabetes. And I'd actually covered failed products like the Gluco watch and things like that. So I had my knowledge around me, and I knew there was going to be no cure in the next 5 years. So we didn't have that. But our endocrinologist did tell us that the artificial pancreas was in the works. And he said 3 to 5 years. And we would probably have that. And I have been hopeful, cautiously optimistic. I didn't hang my hat on that. And I knew we'd have to learn to live well with diabetes without an artificial pancreas. But when I think now to 2006, knowing that is when Molly was in that trial, and other people that I've been so lucky to meet and talk to since, people like Tom Brobson, so many people at JDRF who were involved in the early artificial pancreas project. It kind of boggles my mind to think that I could go back to Stacey in 2006 in that hospital room and say, look, it's not going to be here as soon as you hope, but your son's going to be fine. And you're going to get to talk to these people that right now are testing it out. I mean, to me, it's just wild. And more importantly than silly me getting to talk to all these people, much more importantly is that the people with type 1, as you listen, and my son, get to use it. I'm so excited for Control-IQ. I'm so excited for anything that takes any bit of burden away from people with diabetes. I'm not looking for the world's lowest A1C. You know that. I am looking for a healthy A1C that lets my son live the life he wants without diabetes being a pain in the ass without his mother texting him 400 times a day. Did you bolus? Did you check? Right? All that nagging stuff. I don't want him thinking about it 24/7. And all of these automated processes, when you talk to people who loop, when you talk to people who've used open APS, right, these do-it-yourself systems, their first response to you isn't, look at my fantastic A1C, although they're usually very good. It's, wow, I get more sleep. Wow, I think about diabetes less. Wow, I worry about my kid less. And that, to me, is what it's all about. All of these decisions, I'm getting emotional thinking about it. All of the decisions that everybody with diabetes, forget the parents, that the people with diabetes have to make, and that burden that is on you. I hope systems like this just relieve it a little bit. It's a good first step. It's not the end. There is a long way to go. But that's what I am hopeful for. And I know that I'll hear from you, you wonderful do-it-yourselfers who will be figuring out ways to, hack the sleep mode and change the exercise mode and figure this stuff out. So we will move forward with lots more information in the weeks and months to come. I don't have a way to wrap this up with a big bow. I don't have a way to end this year by saying something incredibly motivational and giving you a boost into the new year. But I do have to say that it's so exciting to end 2019 with the approval that, frankly, I've been waiting for all year, and I know many of you have as well, and seeing that as another step forward and looking forward to 2020 and what may come. Our next full episode will air on January 7th, but later this week, I'm going to be releasing a new mini-sode. I'll be doing more of these in the new year, just really short episodes where I share some thoughts or some advice. I'd love to know what you think about all of that. Big thanks, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. Wishing everybody a happy and a healthy new year. I'm Stacey Sims, and I'll see you back here in 2020. At times, I may mention Tandem Diabetes Care. However, I am not compensated by Tandem for my actions, and Tandem does not support or control this content. I have created the content, and it is based on my personal experiences and observations.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.